name is Kody Bolk. I am one of the otolaryngologists here at SIU, but my subspecialty that I'm fellowship trained in is rhinology and endoscopic skull-base surgery. I grew up actually not far from here, about an hour and 45 minutes south in Carlisle, Illinois. I think the biggest thing is probably golf. It's always been something that I do quite a bit. I actually went to college and played golf here locally. Not as good as I used to be, but still really enjoy playing. Other things are just being outside, a lot of things around the lake, fishing, boating, hanging out with family definitely. I have 3 older sisters who are all in the medical field a little bit as well, 2 pharmacists and one that was a child psychologist as well. We had no one prior that did anything in medicine, so it was new, I think, for all of us, my siblings included. And watching them go through the process, I think, kind of sparked the interest in me as well to pursue a career in medicine. I'm from Carlisle. I stayed pretty local. It's a small Division II school outside of St. Louis called McKendree University. That's where I did my undergraduate and got a bachelor's in science and biology. And then I went to medical school here at Southern Illinois University, and we do a split time between Carbondale and here in Springfield as well. And then following that, I did my otolaryngology head and neck surgery residency in Louisiana. So it was the LSU New Orleans campus. They have a couple programs down there. Following that, I did 1 extra year of fellowship training in rhinology and skull-base surgery at Emory University in Atlanta, Georgia, before making my way back home here. There really wasn't a lot. I was one of those people that whenever I was on the rotation, I really enjoyed it, but nothing really stuck. And then I made my way. It was towards the end of my clerkship rotations to otolaryngology, and that's whenever I feel like I found what I wanted to do. Found the people I liked, found the surgeries I liked, the patients I liked. It really started to click there. I'm a subset of our otolaryngology head and neck surgery team. I do rhinology and endoscopic skull-base surgery. Some of the more common things that we treat are things like nasal obstruction, chronic sinusitis, nasal polyps, diseases that affect the nose in general. But then kind of the more advanced things like tumors inside the nose, tumors around the eye, tumors around the base of the brain, especially pituitary tumors, or things like a brain fluid leak. And some of these we do in conjunction with some other colleagues, like in neurosurgery. I work here in Springfield, and I also have a clinic out in Decatur. And that's nice for that community. We can have people that are a little bit closer to that region come and see me. The biggest thing is I want them to always feel heard and feel like we have a good plan moving forward. I want them to know that I'm always going to be on their side, depending on what that is. It could be medical therapy, it could be surgery, it could be a combination thereof, but we can come to this decision together how to best treat what they have and help them feel a lot better. That's always my goal. I want them to be happy and feel better.